Hello, this is Connie Wallace. I'm on faculty at Nebraska Methodist College, and we're here today to talk about the DEU model at Lasting Hope and the training modules that we have to support that. I have my doctorate in health professional education and a certification as a clinical nurse specialist from AAPNA. This is our list of what we're going to be going over for the DEU training. You'll see we've got 4 different modules, and then we'll discuss the clinical evaluation tool and the attestation form. So the first one, clinical teaching strategies, clinical reasoning and questioning. This was adapted from work previously done by other Methodist College faculty, and it's been tailored to be more conducive to the mental health experience. Our objectives include applying effective feedback on performance in nursing care and identifying characteristics of effective clinical instructors, and then lastly looking at strategies and techniques to facilitate student outcomes. I'd like to share this quote with you as we begin. The mediocre teacher tells, the good teacher explains, the superior teacher demonstrates, and the great teacher inspires. And certainly we all aspire to inspire, but we usually start out at the point where we're telling or explaining. And we'll move into a different level as we continue the teaching process with our students. So the process of clinical teaching includes the goal, which is to foster mutual respect and support for each other. And certainly this is so important because as practicing nurses, we will want to be maintaining that mutual respect as well. Faculty are the crucial link to successful experiences for students. And in terms of following the attributes for clinical instructors, let's take a look at that. Certainly clinical competence is at the top of the list. However, relationships are important too. And so having collegial relationships with students and staff, and again, having expert clinical skills and judgment in real situations. Lastly, having an understanding of theories and concepts related to nursing, but even more importantly, is knowing how to teach. And that might take many different forms for many individuals. It's highly individualized with the clinical instructor, and that's okay. That's a good thing because our students are highly individualized as well. Effective teaching may be the hardest job there is, but that's our goal. I'd like you to take a minute and think about your favorite nursing instructors. And as you do this, please just jot on your PowerPoint handout what qualities they had that made you feel so positively. And I know for me, one of them was having a sense of trust that even if I were to screw up, my instructor was going to, in some way, redeem the situation so A, I didn't do any damage, and B, my self-esteem remained intact. I'd also ask you to think about the qualities that you remember negatively, because those are the attributes that we want to avoid and the situations that we want to avoid getting into. Effective clinical educators have a knowledge of their practice area and clinical competence, and also have the desire and knowledge to teach. And you, being at Lasting Hope, certainly have the knowledge and the competence, and you're teaching your peers as they start as new RNs, and so now you get to be teaching nursing students who will soon to be RNs. As I said, demonstrating knowledge of nursing skills and patient care is one of the attributes we're looking for. And students trust the experienced practitioner's guidance. So therefore, you always want to be demonstrating the best practice and the current practice. In the event a question arises or a practice comes up that you're not completely sure about, please speak right up in front of the student and say, you know, I need to look into this a little more. It's perfectly fine to do that, and it's great role modeling for remembering your professional role and responsibility. The other characteristics that we need to talk about are being supportive of learners. And once again, that relates to mutual respect and having a knowledge of the learners. And if you can think back to when you were a nursing student, that'll probably be a pretty good indicator of where our students are at right now as well. One of the goals is certainly to foster independence. I want to warn you, however, that this takes time. And for the students who are coming into a mental health rotation, many times they are not familiar with the environment. They do not have any prior experience with the setting or with the nursing process that occurs in mental health. So for that reason, even though we're fostering independence, we probably want to make sure that we support the students along the way, being more directive as they're first starting out, making sure that they get to practice those skills and that you're there to help support them. We want to encourage questioning. And one of the best questions is to ask the students as they're getting ready to give a medication or perform an assessment, is to ask them why. Why are they doing it? How are they doing it? What do they know? How are they prepared to do this? And if they can't answer those questions, it would be perfectly fine for you to tell them, let's go back and look into this a little more, get some more information so that you're ready to do this. I'll check back with you in 5 minutes or something to that. Also, reinforce with the students that all nurses ask questions, and that's so important. It promotes collegiality and acceptance. It also ensures that we are monitoring our own practice and the practice of others. Students have a knowledge, but they may not have had the opportunity to apply that knowledge, particularly in something as specialized as a mental health setting. They've learned some basic assessment skills, communication skills, but now they'll be practicing it and demonstrating it in a new way. While all students desire to do a good job, many times they don't feel equipped to do so until they have the support and guidance from their mentor. And questioning often comes from the fear of making a mistake. So we want to encourage question asking. In terms of clinical competency, we want to set the tone for learning and remember that the clinical experiences are actually reinforcing classroom knowledge. And so in that regard, it would be a helpful thing for you as the nurse mentor to say, what have you learned about this? Or how does this fit with what you know or what you've learned about in class? Help them recognize the need to tie in their clinical content with their theoretical content that they're learning in the classroom. Give the student the opportunity to make decisions for their patients, whether it's sequencing activities or when to do an assessment or when to do meds. Just whatever decisions that they can make will build their confidence and also give them a sense of inclusion in the environment. Offer quick praise when they've done something well, but again, we don't want to assume that students understand why they're doing what they're doing. And that's where, once again, that questioning comes into play. Let's talk about effective communication skills. And that's so important. As you know, in mental health, communication is vital. So we want to be able to communicate expectations clearly and set a plan for the day. And this is something where, once again, you can start out your day immediately after report by asking the student, okay, so what is your plan? What is your priority? What do you need to do or know first? And if the students are not able to meet those expectations and not able to answer those questions, explore the situation with the student in more detail. Maybe give them a little more background information and say, well, now if you think about what you heard in report, what would be the priority here? Or what do we need to do first? So again, you're role modeling communication in terms of setting their plan. You also will be role modeling communication to others. And one thing I love about Lasting Hope is that we are very much an interdisciplinary environment in that we have the opportunity to network and work together with doctors, therapists, counselors, transitional care coordinators, and we're all a part of a larger team. And that's an important aspect for the students to realize too, and that their communication will be important in that type of experience. The professionalism that you role model is key Students are very impressionable, and in fact, they are always watching. And I know from my own experience that sometimes what they're watching is not what I necessarily intended for them to see. So it's really important that we pay attention to what we're doing and how we're doing it, so that we are role modeling what we intend to role model. You want to build that professional relationship not only with the students and with your peers, but with physicians and the other key staff members that we just talked about. We also want to demonstrate core values, and the core values for Methodist College include caring, holism, respect, excellence, and learning. So typically the students are very in tune to caring. However, they oftentimes have a little less sophisticated understanding of attributes of caring, which we'll talk about more a little later. And again, that positive attitude. And at this point, I'd like you to think about when you're giving feedback in terms of professional communication, how are you going to say that to the students in such a way that it can be heard and can feel as a positive experience rather than a negative. Next, we want to demonstrate the passion for nursing and teaching, and that's one of the things that I'd really like to encourage you to do, because oftentimes students don't really understand mental health nursing, or have a lot of questions about it, are not completely comfortable with it. And so if you can just share some of your passion for what pulled you into the mental health nursing arena, that could be very helpful and effective for them to realize what it is about this area that ignites your passion and why. And again, that'll provide an excellent role modeling situation for the students as well. I'd also remind you that we want to view the students as an asset and as part of the team. And so when you're going to team meetings or safety huddles, or having a conversation with the doctor or the counselor, please take the student with you and say, come with me as we do this, because once again, you'll be role modeling the interdisciplinary collaboration and your passion for what you're doing. The clinical DEU staff nurse obviously should be approachable and friendly and understanding. And those things seem to go without saying, but yet we need to remember that the students are newcomers in the environment, and for the first few weeks, everywhere they go, it will feel new and different, going from one unit to another, talking with one nurse as opposed to another. A lot of ongoing change as they're getting used to their environment. And so again, that friendly understanding is so important, and making sure you let the student know that you are approachable, you are available, and you are treating them respectfully in their learning situation. Keep in mind, however, though these are in fact students, they're not nurses yet. One of the attributes in the teaching role includes evaluation. And students expect that evaluation is going to occur. However, this might be a new experience for them to be receiving feedback and evaluation from the staff nurse. And so for that reason, you want to talk with the students about what you're seeing and how you evaluated it. Be objective in your evaluation. But also let them know that while it's okay to make mistakes, it's a learning opportunity, and we want to hold them accountable for their actions while being supportive. So in the event a student were to say, well, I didn't know that, you can say, I understand that you didn't know that, but let's talk about what you need to know before you can safely administer a medication. Or let's review the assessment tool so that you will have a better understanding of how to make that assessment and record it accurately. And that relates directly to providing frequent feedback. Reassure the student that they are progressing. That gives them a sense of security and a sense of trust, that they can trust themselves and they can trust their relationship with you. Giving good feedback is a learned process, and you'll have the opportunity to be doing that quite a bit over the next few weeks as you work with students. And that feedback becomes really important because the students recognize that they are working with you and you with them. And so the feedback that you're giving them is on the spot, timely, and very objective. When it comes to teaching, which of course you will be doing as you're working with students in the unit, is to try to identify their personalities and their abilities. And you won't necessarily know that unless you maybe ask a question early on. What do you like about this? How can I help you grow? What skills do you need to practice? That sort of thing. And recognize that knowledge alone doesn't equate to teaching and learning. It's relational and it's application as well. So when it comes to effective teaching skills, we want to talk about 3 domains: the instructional, the interpersonal, and the evaluative. Instructional is strategies to facilitate the transfer of knowledge. And that's one thing that you may not know. What are the students learning about this week or last week in the classroom? But you can ask them as you're doing an activity, whether it's an assessment or going to a group or providing medication. Ask them, what have you learned about this particular experience? So it is instructional, and we certainly are trying to help the student always apply knowledge learned in the classroom and information into clinical practice. Interpersonal, of course, relates to the relationships and interactions. And once again, ongoing asking, ongoing monitoring of how are we using the knowledge that you've learned? How are we building on what you've learned? And then lastly, the evaluations, making determinations about the performance and achievement. And we'll be talking more about the evaluation process and the rating scale, but I just want to bring this to your attention now that it is part of an effective teaching skill. And I'd like the opportunity to discuss that with you before we actually start working with the students. So we'll see when that's going to be scheduled, and we'll have a dialogue. Okay, facilitating learning in the clinical setting is actually talking about the art of teaching. And as we've already discussed, it's instructional and interpersonal. When you look at these characteristics, you might want to look at things such as effective questioning, critical thinking, motivational strategies. So those are instructional, and yet communicating expectations clearly, that is a huge thing to clarify with the student early on and then continue to maintain that. When it comes to interpersonal aspects, correcting mistakes without belittling, one way to do that would be to just say, okay, how could you do this differently next time? Willingness to admit limitations and faults. And one of those might be to just throw in a statement or a comment about, when I was a new grad, I remember having some trouble with whatever. So again, you can share a little self-disclosure for you, which reminds them that you've walked in their shoes as well. And then with the integrity, one of the aspects here is to communicate what you expect from the student at the beginning of each shift. And I would encourage you to be very clear about that in terms of asking them, okay, so the first thing we're going to do is X, Y, and Z. Set the stage and help them focus. Okay, let's talk briefly about some teaching techniques, as these are ways to promote deeper learning. So the instructor skills, of course, are in observing clinical performance and questioning students to promote their thinking and clinical judgment. One of the things that we'd want to do when it talks about planning additional learning activities might be how to stimulate follow-up on their learning. And it might just be, what would you do next? Having done this, what could you do differently? How would you build on it to build that relationship? We also want to try to help the client, the student, recognize that they can apply content the same content that they've learned in one clinical activity to a different situation with a different client. It's transferable knowledge. Clinical coaching is more than guiding. It involves assisting and integrating clinical information. We've talked about that in terms of recognizing the information that they're learning in the classroom and then applying it to assessment findings and helping them use that information to make clinical judgments in regard to client care and assessments. In clinical practice, that is the place and time when students develop their clinical reasoning skills and learn to think like a nurse. Clinical coaching is significant in that with clinical coaching, typically we stand on the sidelines and we let the student take control of what's going on. However, the student will look to you for guidance when needed. And so you want to be there, you want to be accessible, and you want to be aware of what's going on. However, you don't want to interfere unless there's a risk for injury or unsafe practice. Again, you want to offer verbal cues. How might you offer verbal cues when you're working with the situation with the student? Maybe asking them, now, do you remember what their blood pressure was earlier this morning? Or what did you observe in your morning assessment that relates to that medication? So that you're actually helping them on the spot, tying into more than the immediate observation, but pulling in other aspects of information as well. In the event the student freezes or something unexpected happens, that would be the time to step in and intervene and just say, let me assist here. But then once you've done that, you'd want to just step back and allow the student to resume what they're doing, and then you can discuss it shortly later after you leave the client situation. I encourage you to be hands-off when it seems appropriate for the student, and that's variable. Some students will depend on more time and a little more guidance, but my hope is that you will be able to see that the students are growing from one week to the next. And it's possible that they'll be spending time on more than one clinical unit, and so you may not see them for a few weeks, and then they'll come back and maybe you'll be able to say, hey, what have you been doing in the last few weeks, and how are you using that now? So that you're encouraging the student to work independently and not doing everything together. Over time, you want to be able to delegate to the student. Ideally, they might be caring for one or two patients by the time they're leaving, or they're responsible for doing their own assessments and charting. Initially, they may require quite a bit of prompting, but as they continue through the rotation, one would expect that there would be less prompting required. As you may remember from your own nursing education, technical skills are so important, and that's such a tactile way of recognizing learning and achievement. And so it's an opportunity for learning at the, quote, bedside or at the patient, in the patient clinical area, whether it's related to administering medications or an injection, or doing education about medications or diet. Those are all aspects of providing good care and can affect technical skills as well. One thing to remember, and I know as a practicing nurse, you always remember documentation, but it'll be important to include the student in that. Once they've done something, remind them, okay, now let's get you into the records so that you can in fact document what was taught and how the client responded. Interpersonal teaching techniques, of course, would include the effective communication skills and collaboration. And as I said, the collaboration at Lasting Hope is really a phenomenal opportunity to include med students and physicians, dietitian, counselors. One other aspect is appropriate use of humor. I think we all use humor sometimes to cut tension or to just relieve a little stress. Again, we want to make sure that the humor we're using is appropriate because we are always role modeling to the students and they're always watching. Also, just monitor the way you're relating to patients. I realize that sometimes you work with particular clients for a longer period of time and you get to know them and have expectations on those clients. But keep in mind that we want to always be demonstrating a caring attitude in supporting the patients and giving positive feedback. One thing I'd like you to think about is the constructive negative feedback. How can you do that? Sometimes it's difficult to explain the use of, quote, tough love, but many times a client might ask for a medication when in fact they don't meet the criteria or it's too soon to be given. And so that's an opportunity of conveying that tough love and saying, well, we can't do that right now, but let's try this and this. And it just shows different ways of actually being caring for the client and their situation. In regard to the constructive negative feedback, sometimes that can feel a little tricky or uncomfortable. However, it's pretty reasonable and effective to say, you know, one area it seems you could work on within the next day or two is, and then discuss what the situation was and how they could change their performance. Critical thinking, of course, occurs all the time. At least it can if we're promoting it. And so, once again, listening during shift change is hugely important, and then following up with the student and saying, what did you get out of shift change? And it's so important to do that because oftentimes a student brand new to the setting is listening, but they really don't know what they're hearing, or they're not putting it together in terms of what the client needs or situations are. So once again, asking appropriate questions after shift change to help them tie in what's going on will be very effective. Demonstrating proficient problem solving in terms of clinical reasoning, what's going on with the client that warrants this change in medication, or decision making in terms of what we're going to be doing with the client within the next few days. And as you're doing that, remember to ask the client, or the student rather, why? Why are we doing it in this way? What is this serving? It's important to help them process as they're moving along. Some of the teaching techniques, of course, include professional role behaviors, as we've already talked about, and some of the more classic professional characteristics would be the AIDIT, which of course stands for acknowledging who you are and who the client is and what your relationship is, and introducing yourself, and then offering the duration. I'm going to be with you for today or for the next 8 hours or 12 hours or whatever, and then an explanation of what they can expect and what's going to be going on. And then the T is for thank you. In terms of HIPAA, of course, this relates to ethics, and then even a discussion of ethics. And one of the unique aspects of mental health nursing is the role of ethics in terms of mental health treatment, board of mental health, discharge planning, medications, etc. So there's a whole lot of ways to tie in ethics in the client treatment, and that'll be a wonderful learning opportunity for the client, for the student as well. When it comes to giving feedback, we want it to be immediate. Students desire feedback, both good and bad. So at the time, you want to offer some sort of immediate feedback. And in fact, you can be doing that several times throughout the day as the client maybe does an assessment or has an interaction or participates in the environment in some particular way. The immediate feedback should always acknowledge what was done well, and then also where the change could be, where a change could be done, a way to do something differently. And so it's kind of like a sandwich approach where you offer a positive affirmation, then you offer an area that needs an area to change, and then follow it up with one more positive statement. Constructive guidance. You want to do this in a private environment because the student then will feel less threatened, and it might be easier to engage in an actual dialogue with the student about what was going on, what the expectations were, and whether or not they were achieved or how they could have been achieved. And then once again to focus on what went well. Students are usually aware when a mistake is made, but not always. So you always want to start by asking the student, what was the situation? What was going on here? How do you think things went? What went well? What could have gone better? As always, we want to avoid blaming, and we want to avoid the use of negative terms. You didn't do this. Well, instead, maybe you could say, I noticed that when you gave the meds, you did not actually do the correct patient indicators, or you didn't document as thoroughly as I would have expected. Let's go back and review that. Remind students that as nurses, we're always learning, and the student is learning, and yet you in your role are also learning, and this is part of our professional role. If you're upset or frustrated, you might want to take a short break before you actually come back and engage the student, but don't wait too long. You want to be able to follow up, but you do want to maintain your composure if you need to before having that conversation. And I want to remind you too that even though you'll be working very closely with students for the day shift, I, as the clinical faculty, am always around, and I typically make rounds from one unit to the next. And so if I'm not on your unit at the time you want to talk to me, you can rest assured that I will be coming, or I do have my cell phone, and you could call me on that if it's of a more immediate nature. And this ends our first section on clinical teaching strategies. We will be moving on to the next one shortly.